Okay, so here is my concept map. As you can see, the legend is in the corner, and then I just labeled everything out in a color-coded box. I read last minute to put the top priority on the bottom, so there's one in the middle as well. So here's the patho. We'll start with that. So the patho is non-small cell lung cancer according to the patho book. It starts in the outer lobes of the lung. It's slow growing. It's related to smoking 80 to 90% of the time, and this cancer is associated with smoking and COPD. The patient will also have a non-productive cough, chest pain, bloody sputum, and shortness of breath. Lung cancer is initiated by carcinogens, which induces mutations. Then this leads to the development of a tumor. These tumors are promoted by growth factor that alters cell growth. The patient is exposed to toxins such as smoking and pollutants such as chemicals. Then the cells start to mutate, grow, and proliferate, which causes the cell to become cancerous. And then next we'll talk about the risk factors and then the past medical and surgical history. So here is the past medical, surgical, and family history, and right here are the risk factors. So the patient was diagnosed with small cell lung cancer. She has a history of COPD, hypertension, coronary artery disease, CHF, asthma, a tonsillectomy from a prior thyroid cancer. She has a maternal history of COPD and lung cancer, a paternal history of hypertension and diabetes, and she's also had a right lobectomy and a Mediport placed. So then we'll go into our risk factors. For her risk factors, I put she's a smoker, 1 pack per day for the past 40 years. She has a maternal history of lung cancer. She presented to the ED with weight loss, shortness of breath, and a cough. Alright, and then we'll go into the labs, which are right here in blue. So her sodium is 142, which is normal, so that's a good thing. Her potassium is 3.4, which is high. This could be due to the patient being dehydrated from being in surgery. This is concerning because she needs some fluids hung. Her BUN is 8.1, which is normal. Her creatinine is 0.54, which is low due to the patient not having a good diet. So we need to make sure she gets something to eat and something to help with her nutrition. Her white blood cells are 12,000, which is high due to the inflammation or possible infection. This isn't concerning because you don't want the patient to become sick or even more sick than she already is. Her red blood cells are 12.4, which is high due to the patient having the lung cancer. Then her hemoglobin is 8.1, which is low due to the patient possibly being anemic, or since she just got out of surgery 2 days ago, she could still be bleeding. This is concerning because if she's bleeding internally, we don't want her to lose too much blood. So we want to find the source of that bleed as soon as possible if that's the case. Her hematocrit is 28.5, which is low because the patient could be anemic or because she has that mass and tumor on her lungs. Her calcium is 7.4, which is due to the patient having a poor diet and no appetite, as stated above, or in the case study, not above. This isn't concerning again because you want the patient to have a good diet and heal properly. Her albumin is 1.6, which is low, which indicates the patient has poor nutrition, which isn't concerning because she needs good nutrition to heal properly. Her glucose is 130, which is high. And this is concerning because bacteria love sugar and the patient's white blood cell count is also high, which indicates the patient is more at risk for developing an infection. Her TSH is 2.1, which is normal, so that's good. And then next we'll discuss her medications, which is in this purple box. So she is on acetaminophen 350 milligrams PRN every 6 hours for a pain rating 1 to 3 and a fever greater than 100.4. For this, I said do not exceed the recommended dosage. Toxicity includes nausea, vomiting, abdominal pain. This is not an anti-inflammatory agent. You need to report rash, unusual bleeding or bruising, yellowing of the skin or eyes, changes in voiding patterns. And then for side effects, I put rash, hives, nausea, leukopenia, thrombocytopenia, hepatotoxicity, cyanosis, anemia, jaundice, headache, chest pain, and dyspnea. And then next we have levothyroxine, 125 micrograms before breakfast for her thyroid hormone replacement. Some side effects is nervousness, arrhythmias, hypotension, tachycardia, and hair loss. For a teaching point, I put administer in a single dose before breakfast to prevent insomnia. Then next we have atorvastatin, 80 milligrams nightly for her coronary artery disease. It's necessary to receive blood work and eye exams during treatment. Have a regular diet and exercise. She needs to avoid grapefruit juice. Her diet should be low fat and cholesterol. She needs to use UV protection to prevent her photosensitivity. Side effects include headache, abdominal cramps, infection, diarrhea, and liver dysfunction. Next we have Cozar, 50 milligrams for hypertension. I said to take with milk or food to decrease GI irritation, and I said to hold if the blood pressure is greater or less than 100. Some side effects include dizziness, hypotension, depression, and headache. Next we have metoprolol, 100 milligrams daily for hypertension. The side effects include fatigue, weakness, bradycardia, erectile dysfunction, and it may cause drowsiness, and she needs to carry a ID bracelet with her. Then we have hydrochlorothiazide, 25 milligrams daily for hypertension. The side effects include hypokalemia, weakness, hypotension, dehydration, photosensitivity. I said administer in the morning to prevent disruptions in the sleep cycle, and give with food or milk to minimize GI upset. And then we have hydrocodone acetaminophen, PRN every 4 hours, 5 to 35 milligrams for pain greater than or equal to 4. Some side effects include nausea, vomiting, urinary retention, lightheadedness, dizziness, sedation, mental clouding, constipation. And I said to take with food and then hold if the respiratory rate is less than 10 beats or 10 breaths per minute. Next we have the Duoneb every 4 hours for asthma and COPD. Side effects include headache, dizziness, nausea, dry mouth, shaking, nervousness, constipation, or cold symptoms. And then I said it contains the 2 meds. Then I have Singular, 10 milligrams daily, taking to break up her secretions. Side effects include headache, cough, abdominal pain, influenza, dizziness, fatigue, and dental pain. It's not a rescue med. Then we have Colace, 100 milligrams 2 times a day for constipation prophylaxis. Side effects include nausea, anorexia, cramping, diarrhea. Laxatives should be used for a short period of time and do not use when constipation is accompanied with pain, fever, and nausea or vomiting. Then we have Lovenox, 40 milligrams daily to prevent DVT. Side effects include fever, confusion, nausea, edema. And then I said to report signs of bleeding and use a soft bristle toothbrush. Then we have pantoprazole, 40 milligrams for GERD. Side effects include headache, abdominal pain, diarrhea. And I said do not break, crush, or chew this tab. Then we have Zofran, 4 milligrams PRN every 12 hours for nausea. I put side effects as abdominal pain, dehydration, electrolyte imbalance, diarrhea. Do not crush or chew. And then here is the assessment findings. So she had a temp of 98.6, a heart rate of 78 beats per minute, a blood pressure of 166/82, a respiratory rate of 22, and O2 sat of 94 on 4 liters. Respiration, she heard coarse crackles, and she also has hypoactive bowels, and for skin she has an incision and a chest tube. So next we have the diagnostics. So I put a chest x-ray was done. It found a mass in the right lung, and a CT was also done to show a 96 millimeter mass in the right lower lobe and 2 10 millimeter masses in the left lower lobe. So these were done to help the doctor see the mass's size and shape. And then next we will go into our nursing diagnosis. So I put pain related to non-small cell lung cancer in the chest tube. For intervention, I put the nurse will perform comfort measures to promote relaxation, such as massaging, bathing, and repositioning. These measures will help reduce muscle tension and help the patient focus on non-pain related tasks. The nurse will allow periods of rest. This will promote health, well-being, and increase the patient's energy level. And then I said the nurse will ask the patient to help establish goals and develop a plan of pain control and give the patient a sense of control. So the goal is the patient will have a tolerable pain level within the next 30 minutes. And then next I put fear and anxiety related to a new diagnosis of non-small cell lung cancer. For interventions, I put the nurse will listen attentively, allow the patient to express their feelings verbally. This may allow the patient to identify anxious behaviors and discover the source of the anxiety. I said the nurse will explain all treatments and procedures, answer any questions the patient might have. This will reduce the patient's fear and anxiety. The nurse will remain with the patient when she's experienced a higher than usual level of fear and anxiety. This will promote the patient's relationship and provide the patient with support. So the patient will have a decreased amount of fear and anxiety or tolerable amount within the next hour. Then next we have impaired gas exchange related to the chest tube and the lung cancer. So for interventions, I said the nurse will have the patient cough and deep breathe. This will help clear the airway. Then I said the nurse will change the patient's position every 2 hours. This will help mobilize the secretions. And then I said the nurse will include periods of rest and cluster their cares. This will help reduce oxygen demand. And the goal for that, I put the patient will have normal breath sounds within 12 to 20 minutes, and those normal breath sounds would be 12 to 20. And then for culture, I put she was a smoker, so we need to teach the patient the benefits of quitting smoking and providing the patient with handouts regarding the benefits, so she has something to look at when you are teaching her. And then I said to provide her with other options to do besides smoking, such as like eating sunflower seeds or picking up a different hobby. So this is my concept map. And then impaired gas exchange was my top priority.